Hi, welcome back to my YouTube channel. I'm Dr. Fatma Salim. Today I will be talking about complications of diabetes. Before then, let me remind you what diabetes is and the types of diabetes. Then we proceed to today's topic. Well, like I said last time, diabetes is increase of or excess sugars in our blood. There are two types of diabetes. The first type of diabetes, or type 1 diabetes, is when the immune cells attack, the beta cells, uh, causing them not to produce insulin. Insulin, this is a hormone that controls sugars in our blood. So this is where there is no production of insulin at all, and patient is forced to be injected insulin on a daily basis. Type 2 is when the insulin is produced in the body but is not sufficient enough to cater for the sugars in our blood. To remind you again, type 1 diabetes starts from childhood to adulthood. Type 2 diabetes, it starts from adulthood. Well, having said that, today I will be talking about the effects of diabetes on different organs of our body. Excess sugar in our blood reduces elasticity of the blood vessels. For instance, this is a vessel. When there is a lot of blood to pass, then the vessel usually expands and allows the blood to pass freely. To remind you, blood vessels are usually in a circular form or a circular shape. So when the blood is supposed to pass through, what the vessel does, if the blood is over a higher pressure or anything, it expands like this. Okay, so what the sugars do in our body, in our vessel, is that they reduce this elasticity. Okay, they reduce it and causing the blood vessels to narrow. So this is, for instance, how the normal vessels appears if it has not been affected by diabetes. This is how it appears after diabetes, or it can even reduce to an even smaller size. So if you can see the difference, this one has a larger diameter compared to these two. This is caused by diabetes. To explain everything, or to make this clear, what I'm trying to say is that elasticity reduces. So if the elasticity reduces, it causes narrowing of these vessels. Narrowing of these vessels causes a lot of health issues in different organs or in different parts of the body. Why? Because this reduce in shape of the blood vessels causes the blood to pass with a lot of pressure. That is one. Two, it reduces the oxygen level that is supposed to be circulated to various parts of the body. So this is the normal lumen, normal diameter of the blood vessel, and then all of a sudden, because of diabetes, it's reduced to this size. What happens is that after it has been reduced, the blood will be passing through with a higher pressure. That higher pressure that passes through here causes a lot of problems in other vessels and in other organs, in the sense that there is a delay of blood supply, there is inefficiency of oxygen, because if you can imagine, if blood was to pass here, a lot of blood was to pass here, then it would have been supplied to various parts of the body faster, and the oxygen rate would have been okay. I mean, the percentage would have been higher. But if it is reduced, the percentage of oxygen is reduced. At the same time, the blood passes with a lot of pressure. Pressure is not good for our organs. It's not good for our body. What happens when this when this happens? There are different types of blood vessels. We have major blood vessels, or macrovascular, and we have minor blood vessels, small blood vessels, as microvascular. Now, if these big blood vessels are affected, they affect different types of organs in our body. For instance, they affect the brain and causes stroke. They affect the heart and causes a heart attack. They affect our limbs and causes peripheral issues. These minor ones, when they are affected, and when they are the minor or the small vessels, when they are affected, they cause issues on our kidneys, issues on our eyes, on our gums, and on our nerves and various parts of the body where these small vessels supply. That being said, when you hear someone is going through an amputation, it's because, for instance, for the major vessels, if they affect our limbs, then the limbs muscle cannot be supplied with enough oxygen. What happens is that they start, so to say, rotting, as they call it, or you might hear doctors saying that, the leg has become poisonous, so it has to be chopped out because it will affect other parts of the body. Okay, in the sense that because these muscles depend on oxygen to be alive, when there is no oxygen that is supplied there, what do? They die. So that's one of the reasons as to why one gets chopped. I mean, one's get chopped, and or they are amputated, they are cut off. Again, you might have heard of people with diabetes complaining of, numbness, or at times they complain of warmth sensation on the limbs, or whether it is the arms or any other part of the body. Someone will be complaining, oh, I feel hot, it's as if something is warming my limbs and all that. All the time I feel like something is warm inside me, and all that. It's because of that, because these vessels affect the nerves and all that, and they cause this type of issues. Well, that being said, I hope this is clear. To avoid this, patients are supposed to adhere to their medication. At the same time, patients are supposed to do regular exercises, mind their diet, and all that. Please tune in for my next video, whereby I will be explaining about the type of meals one is supposed to take in case they're suffering from diabetes. Thank you so much. Till next time.